patients that I see who've had traditional women's health treatment, and they're always trying to strengthen. So nobody's talking about, releasing the fascia so that that muscle fiber can actually work, because it's stuck in this, straitjacket.
Right.
So doctors are starting to learn about women's health, but then they're getting a traditional treatment that's using some maybe biofeedback when they're trying to have them contract, and then they're not talking about releasing that tissue that's actually pulling everything down.
Right. Yeah. So going along with the scenario, you're right on. When our pelvis twists, that shortens the muscle. When you shorten the muscle, it weakens. Then the fascial system tightens down. It makes things worse. And I've found that exactly what you're saying is we will bring up Kegel exercises to our patients, and most will resist that because they've tried it and it didn't work. So I fully understand that's because you didn't have myofascial release. So that, and this applies to athletes too, but so that when you combine this with myofascial release, it'll work, and it's very important you strengthen your pelvic floor. So you combine that with that, and then that can be also horrible prolapse problems. So when your pelvis twists, the adductors, which is inside thigh muscles, tighten down, it fascia reaches up into your pelvic floor from your leg. You got this enormous pressure with a weakened pelvic floor pulling your organs down and out. So you release the adductors, you release all the associated areas, and in most cases it's going to be okay. Sometimes it's too late, but and the same with bladder. Huge problems with bladders too.
Yeah, and that's what's so beautiful about this work, I feel, is it's about releasing what's pulling it, not that it just dropped.
Right.
There's this pressure and this pulling from completely different mechanism.
Exactly.
You're acknowledging.
Exactly. We have to look at every organ of our body as a fascial sac that should be capable of expansion and contraction. Every nerve, blood vessel, and duct that feeds into every organ is a fascial structure within a larger fascial structure. And they're all meant to glide upon one another. We get fascial restrictions. These fascial sacs we call organs are being crushed. The ducts, the nerves, the blood vessels, all of that is not functioning properly, including fallopian tubes. That's why a lot of women cannot conceive, because you have 2,000 pounds per square inch of pressure on a fallopian tube. Sperm can't get into the way nature intended for it to happen. Just another little side thought, I think you might have seen these videos. Some of you have seen the videos. When a sperm hits the egg, there's a flash of light, there's an explosion.
Yeah, I saw that.
Life is light, we're light beings. So it's really important to resolve that and strengthen the pelvic floor, but you don't have to do it properly till you rebalance the pelvis and release all the associated areas. And it makes a world of difference for you.